My name is Janine O'Flynn. I'm Professor of Public Management at ANZOG and also at the University of Melbourne. And I'm the subject leader for the foundation subject, Delivering Public Value, which is a subject in ANZOG's flagship Executive Masters of Public Administration. And I'm absolutely delighted to be able to host this event today. It's now my pleasure to introduce our speakers today. In the field of public management, Professor Donald Moynihan is one of the biggest names and the brightest stars. So much so that I have allowed myself to be lured out of hibernation of study leave to facilitate this webinar today, just so I could share the platform with him. Don holds the inaugural McCourt Chair at the McCourt School of Public Policy at Georgetown University in Washington, DC, and is visiting professor at both Oxford and Aarhus universities. As well as numerous influential publications, he brings wisdom and knowledge of how government works to outlets like the New York Times, the Washington Post, and The Hill, and he is a prolific and influential tweeter. His presentation today draws on the major and prize-winning book he has co-authored with Professor Pamela Herd on administrative burden, policy making by other means. I'm also delighted to introduce Sarah McDowell, who has been the Energy Director at the Essential Services Commission in Victoria since May 2018. She has worked in the energy sector for 15 years, holding positions in state and federal regulatory agencies, including the Australian Energy Regulator. She's also served as Senior Energy Advisor to the Victorian Energy Minister from 2014 to 2017. Sarah has led the ESC's work on changing the Energy Retail Code to require energy retailers to respond appropriately to victims of family violence, which will be the subject of her presentation at today's seminar. Before we get started with the presenters today, I'd like to just make a few opening remarks before we move into our discussion with Don and Sarah. As a researcher in public management and a keen observer of government activity around the world, I'm always keen to learn about what works, what doesn't, and who is affected by the decisions that governments make. At this moment in time, I think we can all see that there's a virtual maelstrom of issues that are confronting government and society. The full scale and scope of COVID-19 is still unknown, with social health and economic costs likely to ripple across the world for many years to come. A few weeks ago, the United Nations stated that COVID-19 was wiping out in just a few months the years of gains that have been made towards the Sustainable Development Goals, that more than 500 million people may move into poverty, and that intimate partner violence was increasing around the world. At the same time, some 1.6 billion workers in the informal economy, many in developing countries, looked likely to lose their livelihoods. Practices like poaching and deforestation have soared as people around the world try to make a living. 50 million Americans have applied for unemployment benefits, and the EU has just inked a deal of €750 billion to try and rescue the European economies from its worst economic disaster since World War II. As it stands, about 15 million people have been infected with COVID-19 and more than 600,000 are dead. At the same time, we've seen the international explosion of the Black Lives Matter social movement, which is challenging societies in many ways and also bringing into sharp relief the role governments have played in both embedding these sorts of racial issues into our institutions and also attempting to address them. Calls to defund the police are being developed as a clarion call for the need for us to examine how we go about getting the work of government done and what this means for our communities. Right now, I think we can all say we're in the midst of a disruptive moment in history. What is clear is that many complex interconnected challenges lie ahead. Some of these are new, but COVID-19 is acting as an accelerant to lots of issues that we've faced for a long time. Poverty, inequality, racism, and authoritarianism being the most obvious. Facing up to these is likely to be just as complex, requiring integrated and interconnected responses that draw on a whole range of actors and disciplines and perspectives. In my own work, I've been looking across a range of different types of relationships between government, organisations and others, and the full use of mechanisms, from regulation to client co-production and contracts. Indeed, I would say that until pretty recently, I've spent most of my time looking at these mechanisms and designing, working out how to design the best relationships for how to get the work of government done. But in recent years, though, I've become much more interested in the morality of some of these mechanisms and the moral questions that emerge. As I said, I'm on study leave at the moment, except for this 1 hour this morning, working on a range of projects. But the most important one for me is a book I'm working on called Markets for Misery, which looks at how some of the mechanisms that we use, like outsourcing, in areas of extreme human misery, create more problems than solutions. And here I'm really interested in asking questions about how we use these tools of governing and the effects of them on people. So like you today, I'm very much looking forward to hearing from both Don and Sarah about some of these ethical and moral questions that confront us. So today I just am going to hand over to Don.
Thank you, Janine. I'm delighted to join you all today, wherever you happen to be. I am in Washington, D.C. It's evening here, and I'm hoping that we will have an interesting discussion. So I'm going to start by talking about this topic of administrative burden, which is something we started writing on a couple of years ago before this current maelstrom that Janine referred to emerged. And I wanted to give a rationale for why we were interested in what sometimes seems like a relatively dry and mundane sort of topic. And the best way to start is, I think, offering a fairly specific example. And so this is a picture here of Merle Mayo and her husband, and it's the first page of our book, so I'm just going to read a section of that discussion. After September 11th, amid unimaginable grief, victims' families found themselves awash in paperwork, applying to everything from workers' compensation to private charitable support and life insurance. Merle Mayo lost her husband in the World Trade Center. In the days following his death, she spent countless hours finding out what financial resources she was eligible for, filling out forms, pulling together documentation, and dealing with officials who offered varying levels of help and sympathy. Everything was scattered all over the place, she said. And then I thought about all the things I had to do and all the laundry that was overflowing from the hamper, and I felt so overwhelmed that I broke down so badly I couldn't even catch my breath. I sat down on the floor just like, I have to do this, I have to cry now, and I did. Yet Mayo remembered one application process as being refreshingly simple: Social Security. She just had to make one phone call and fill out a simple form online, or if it were more convenient, visit one of more than 1,200 Social Security offices around the country. The first Social Security checks to victims' families were mailed out on October 3rd, 2001, obviously less than a month after 9/11. This is a simple example of how we want government to work. Public agency offered a helping hand at a moment when help was desperately needed. All too often, as is the case now, our experience of government is the opposite, characterized by confusion, delay, and frustration. And so this talk is about those administrative burdens, their political and organizational origins, how they affect citizens, and how people who work in government can think about them. So what do I mean by administrative burdens? I'm going to talk about three broad buckets of costs that people encounter: learning costs, compliance costs, and psychological costs. And I'll explain what each of those are in just a second. But first, I also want to explain why we are interested in this idea of administrative burdens. So my co-author, Pamela Herd, is a sociologist. I studied public administration, and we've been studying the implementation of public policy together for a long time. And what we noticed across policy areas and across different scholarly disciplines like political science, policy analysis, sociology, economics, there wasn't a standard conceptual language or framework to understand people's experiences when they engage with government. And so we set out to try and build that by capturing this idea of burdens as a series of costs. Our hope was, in doing that, by developing some sort of standardized framework, it would make it easier for both practitioners and academics to talk to one another, academics from different backgrounds to talk to one another, and for discussions across different policy settings. That it would make it easier for people, for example, who work in the area of election administration to find common cause with people who study social welfare or abortion access, for example. So some parameters before I get too far into the talk. One is we're interested in the burdens that arise from public services and how they're experienced by individuals. And so we're less interested in this particular case in the regulations that affect private organizations. We're also particularly interested in whether people can access public goods or individual rights. And so again, that's something different from a well-established literature on regulatory burden and a well-established set of tools to identify and minimize regulatory burden. It's also worth addressing right at the start that we don't argue that administrative burdens are always bad. There are a variety of possibilities here. One is that in some cases, burdens are legitimate, so they serve to provide some useful benefit to government that exceeds the cost that they impose on individuals. A second possibility is that burdens produce costs for individuals, and those costs potentially outweigh whatever benefits they produce. And the third possibility is that burdens produce really large costs and are not at all outweighed by any potential benefits. And we're more interested in those latter two categories, cases where the costs are high relative to the potential benefits, or it's not clear that the burdens are justified by the benefits that they produce. So to unpack those three boxes I talked about earlier, learning costs, compliance costs, and psychological costs. Learning costs are the idea that we all have to engage in some sort of search processes to collect information about a public service. So to figure out if it exists, if we might be eligible for it, what we might have to do to apply. This is not innate knowledge that we're born with as individuals. It takes some level of time and effort to collect that information, and it might be just enough for us to be dissuaded from actually engaging in these search processes. The second category is compliance costs, and this falls into what we might traditionally think of as responding to red tape. So filling out forms, completing documentation, providing documentation that demonstrates, for example, you are who you say you are, or you fall into a certain category that the state is interested in. It may involve paying fees to participate in processes or traveling distances to go to an administrative office, but basically the sort of time and effort and financial expense you encounter when you interact with the state. The final category that we identify as cost is psychological costs. And this varies and has its own sort of subcategories, the first of which is stigma. So if you interact with the state in some sort of program that has a negative popular perspective, you might experience that stigma as being something that's damaging to you personally. Another basic psychological trait that we like to maintain is a sense of autonomy. And so if we're put in a position where we lose some of that sense of autonomy, that can make it more difficult for us to function on a day-to-day basis. The final category of psychological costs we're interested in is stress or frustration. So if, for example, the potential risk of losing a benefit or dealing with some of the hassles that I talked about earlier, like filling out forms or dealing with websites that are hard to negotiate, or bureaucratic language that you don't fully understand, can generate some measure of stress or frustration. And some studies have actually tried to measure this at the physiological level, looking at how people's measures of physiological stress increase when they have to complete additional forms or provide information that they might have already provided. So those are the categories of burdens, and I hope those categories are useful for you in thinking about the type of public services that you're involved in. Next, I want to sort of make the argument that these burdens matter and that they probably matter more than we might realize, with a couple of pretty simple examples. So the first reason why burdens matter is that they have consequential impacts. And these can be for services that we encounter that we have no choice about, that we have to engage with. So for example, you have to pay your taxes, and in the US, this is a very time-consuming process. And so by one estimate, The US public spends the equivalent of about $196 billion per year on tax reporting efforts. And this is just individuals, we're not talking about businesses here. So that's a big number. It suggests that these burdens probably have perhaps a bigger impact than we might anticipate. In cases where we might interact with a government process, but we're not required to, the burdens can have an effect by discouraging us from maintaining or persevering in that process. And so here is a screenshot for an op-ed we wrote in the New York Times as the COVID response started to emerge in the US. And we wanted to make a point here that the US had moved somewhat quickly and spent a lot of money in designing a response to try and minimize the effects of the COVID on people who were unemployed. But that was in some ways sort of a flawed design because they relied on existing unemployment systems to get those benefits to individuals. So I think Janine mentioned something like 50 million people had applied for unemployment systems. Those are run state by state, and there's huge variance across states in how much difficulty people have in actually negotiating the unemployment process. So in some states like Florida, something like only 10% of those who are eligible actually receive the benefit, whereas in other states like Massachusetts, it's much closer to 3/4 of those who are eligible. And so the people don't really vary that much across these states. What's happening is that they're interacting with very different processes, which are designed to be more or less onerous, with the result that in some cases, people are simply failing to negotiate the process. And so Florida has sort of been the poster child for the failure of these administrative systems, partly because the governor of Florida was willing to turn around and blame his predecessor, and they were both members of the same party, right? But he used some fairly aggressive terms to describe the nature of the system that was designed. But multiple people who had worked with that former governor said, look, we were told to design the system that would keep unemployment numbers down and would discourage people from accessing the unemployment system. And so they didn't make it one that was terribly easy to access. And then when millions of other people tried to manage to negotiate that system, many of them failed. So as you can see here, even by late April, only a tiny fraction of those who applied for unemployment were actually getting paid. And this was accompanied with pictures like this, where you saw people becoming so desperate for help that they would just stand in line at state offices to try and get help because the websites were crashing, no one was picking up the phone, and they were trying to have a conversation with someone who would actually help them to negotiate the process. And so this is one way that, at least thus far, you would say the US approach to the COVID response, I think, gets a fairly dismal grade. The second sort of point that we want to argue, in addition to the fact that these burdens have a big impact, is that they also deploy that impact in a way that might facilitate or encourage inequality. And so we refer to this as the point that burdens are distributive. They fall on some groups more than others. And so if you live in a state where you're low income, you may have greater difficulty getting access to benefits because you have to provide more documentation. You may find it more difficult to vote. If you move relatively frequently, you have to re-register, and we know that frequency of moves is something that's associated with being a low-income individual. You have to re-register every time, which is one of the reasons why there's a big gap between high-income and low-income citizens when it comes to voting in the United States. Basically, high-income citizens are much more likely to be registered, partly because they don't move as frequently. You're also going to be more likely to be subject to things like police stops, which in turn bring about their own sets of burdens as well. A second reason why these burdens might have a distributive impact is not only are some groups more likely to be targeted by burdens, there's going to be variation in what we think of as human capital across groups. The sort of traditional economics way of thinking about administrative burdens, or what they describe them as ordeals, is that people will deal with certain amounts of hassles depending on their utility function. Right. So if I see a long line and I might be able to get some sort of benefit for me at the end of that line, I might be willing to stick out that long line if I really value the benefit, whereas someone else who doesn't value the benefit quite as much decides, that's not for me. And so if you believe that approach, then using these sorts of ordeals becomes this rational way to limit access to benefits if you only want it to go to the truly needy. That's the theory, at least, from economics. The empirical evidence suggests that the variation in take-up of these services tends to be more likely associated with human capital. So with things like people's education, literacy, economic resources, language skills, and even just personality traits like perseverance that allows them to negotiate these administrative processes more successfully than others. And one point we made in the paper that was cited in this last slide here, which is open access online if anyone is interested, is that over our life course, sooner or later, most of us are going to end up in a situation of, it could be scarcity, true poverty, illness, true poor health, or just aging, where we have some increased need from help from the state, but those basic conditions also tend to undermine our executive function. And by executive function, I mean the part of the brain that helps us to learn new information, that helps us to prioritize tasks, that is associated with resilience in the face of discouragement. And so if you need more help, but also because of experiencing scarcity or illness or cognitive decline as you get older, you're less able to muster up the sets of cognitive skills that you need to get over the administrative barriers, the fact is that you become more likely to lose out. And so that variation in human capital might then mean that those who are stressed, sick, who have lots of things going on in their lives are less able to negotiate the administrative burdens that we put in front of them. So I want to conclude by talking about what are potential ways to minimize or reduce burdens. But to do that, we first have to recognize the fact that burdens are themselves a function of choices that are made. Right? They're a function partly of political choices, partly of administrative choices. The processes that we design are not something that are found in nature. They reflect a series of choices, and in some cases, they may reflect deliberate choices to make processes more or less onerous. And it's only until we acknowledge that point can we actually think about how you can deconstruct burdens to make them work better. One obvious potential solution here is the use of technology, and I'll give an example of that in a second. But I want to advertise the fact that technology can be sort of a highway. It can help to facilitate people to get access to help, but it can also be a fortress. And so one case that I've written about when it comes to administrative burdens is the state of Arkansas, when they were asking people to sign up for public health insurance, so Medicaid. If you were poor, you had to demonstrate that you were working, so you had to provide all of this information. And they provided access to reporting this documentation in an online-only situation. And so about 1/3 of the people who are eligible for Medicaid are just not technologically literate. They cannot manage basic things like adding an attachment to an email, cannot manage websites. And so you're right away, if you're having this online-only interface, excluding a huge proportion of the people that need the benefits that you're promising to provide them. Another approach to minimizing burdens is to look for ways to automate processes. And sometimes we talk about nudges to encourage people to get through difficult processes. This is sort of a super nudge where you use a mixture of administrative data and technology to identify who is eligible and then essentially enroll them into the administrative process, and then allow people to opt out if they want to opt out, but you're basically changing the default. And we have some examples of that. So to take the current situation in the United States, I talked about the unemployment process. That's essentially an opt-in process. I have to get my forms together. I have to go to a website or go to an office to try and get unemployment. Many European countries, including my home country of Ireland, basically just enrolled people automatically. If you were working, you continue to get some fraction of your payment that was automatically provided to you. You didn't have to go through the nightmare process of trying to figure out whether you're eligible or not, what forms you needed to complete, what documentation you had to provide. The state essentially did that for you. There are also going to be cases where people just need help, where one potential nudge here would be to tell people, hey, did you know you're eligible for this benefit? And if we send you a text to remind you of that, maybe you're more likely to participate. That sometimes works when the problem is learning costs. But if the problem is compliance costs, that is, the administrative processes are really just legitimately complicated, simply telling people, hey, you're eligible is not enough to help them to get through the process. Right? And so what we need instead is, and there have been some field experiments that have demonstrated this, if you offer help for things like applying for student loans in the United States and walk people through the process, that has a much more significant effect on whether people complete the process than if you just tell them that they're eligible. Another potential nudge here that people can use that combines, again, administrative data and information technology is automating help. So what I'm describing here as automating help is pre-completing forms and sending those forms to people with the information already included, and so they just have to sign the form. And this particular study here that I'm showing you is it's an income-based repayment system for student loans that the federal government in the United States runs, and it's for most people a much better deal than paying their student loans in nominal terms. So it anchors their repayments each month at the lower level. It's a good deal. People should sign up for it, but only about a quarter of people were doing so, only about 24%. What this experiment demonstrated is that if you took that population, identified who was eligible, filled out their information using administrative data, and then sent them the form and said, hey, you're eligible for this. All you have to do is sign it and return it to us. Participation then jumps up to 60%. So a huge effect in terms of take-up of the benefit. The final example of this thinking about burdens, and I wanted to finish on a sort of positive example and return to the example of Social Security that I mentioned at the start of the talk, is simply designing programs in ways that are intended to be accessible. And so going back to the 1930s, amidst the Depression, a time very much like now, arguably even more serious, the US started its pension system. The US had a version of pensions that was tied to the Civil War prior to that, which was a disaster. It was sort of corrupt. It did not work terribly well. And so the previous historical experience of pensions was not good. The US adopted Social Security at a time when it wasn't a very sophisticated administrative state, but it made a series of choices that made Social Security incredibly durable, very popular. It's commonly referred to as the third rail of American politics, in that if you touch it, you will kill yourself. You can't mess with Social Security. And it sustains its popularity in large part because the people who designed it to be a program that feels simple, right? If you, again, turn 65 or whenever you decide to retire, it takes you maybe 10 minutes to enroll in Social Security. And that simplicity maybe disguises some of the complexity of the program. At the time, for example, when the program was being designed, one potential opportunity, recommendation was that the United States would enroll people using stamp books. And so every quarter, your employer would give you some stamps. You would put those stamps in the book. You would collect a series of books over your lifetime. And then when you turn 65, you would turn those books into the federal government and they would start paying you a benefit. And you could sort of see all of the ways that that might go wrong. Your employer might withhold the books. If you're like me, you would lose the books. There could be a black market for these stamps. There are many ways that this could fail. And so instead, what the Social Security Administration came up with was this innovative new technology called a Social Security number. So every American at birth was given the Social Security number that the government then used to track them throughout their life. So I'm calling this a technology, and it really was a big change for the US welfare system. And it's still the closest thing we have to a national ID at this point. There are other things that the administration did well as well. That included having a very welcoming atmosphere. So if claimants came to a field office, the employees who worked there were instructed to treat them as claimants who were receiving rights rather than welfare recipients. And so the culture of the organization was intended to be respectful of the people that it served. I'm going to stop there. I'm really looking forward to your questions and moving on to the next session of the presentation.
Thanks very much, John, and I'm very delighted to hand over to Sarah in a moment, and I'm seeing some great questions come in, so people who've still got questions, send them in or vote on the questions that we've got. I'm sure we're going to have a great discussion. Sarah's going to take us through a really fascinating story of how an economic regulator took on a major social policy challenge in response to recommendations from the Victorian Royal Commission into family violence. Thank you very much, Sarah.
Thank you. And so I come to you today not with the collective academic experience of Janine and Don, but essentially of 15 years of unintentionally creating barriers for consumers, or hopefully not all the time, but certainly the story I've got today is a story where barriers were unintentionally created, but then thankfully 14 years later, those barriers were removed. So I'll just get to the next slide. So essentially the story really starts in 2006. Now in 2006, the Victorian government legislated to require energy companies to have hardship policies and programs. Those policies and programs were required to include a range of assistance measures. And that included payment plans, the requirement to undertake energy efficiency audits, as well as appliance replacement. By design, the access to that program wasn't defined. At the time, government considered energy companies would know their customers best. They would know what hardship meant for that customer base, and therefore, by design, the government didn't define what hardship was and who should access those hardship programs. The Commission's role in relation to energy hardship policies and practices was to produce guidance in relation to those policies and programs, but also to approve energy companies' hardship policies. At the same time, in 2006-2007, the Commission was being asked to do this. I came along to the Essential Services Commission as an economics graduate, but my first role was to assess those hardship policies against the law and against the Essential Services Commission's policy framework. Now, when I was making that assessment, I was not considering the customer experience. I was not considering whether or not these policies would actually prompt a customer to seek assistance. And I wasn't considering, well, what type of hardship will these customers be experiencing? And are those hardship policies and programs, are they tailored to support those customers in need? I was simply going through a ticker box exercise where I would be looking at what the policy set out. Did it include a payment plan? Did it include energy efficiency audits as one example? And I'm afraid to say, even that with that low threshold of an assessment back in 2006, 2007, many energy companies still didn't meet that threshold. Then fast forward to 2013-14, Victoria, where the Essential Services Commission is based, Victoria is experiencing record numbers of customers being disconnected for non-payment of electricity and gas bills. This outcome led to the state government initiating an inquiry into energy retailers' hardship policies and programs. And to save you reading the report, the inquiry found that the hardship policies and programs were in fact not effective in supporting customers experiencing hardship. But what also the inquiry found was that customers experiencing family violence, in particular, experience many different barriers to accessing support. This finding was also echoed by a Royal Commission into Family Violence. At the same time, the Victorian government had commissioned a Royal Commission into Family Violence, which found that energy companies, through their systems and processes, had created many different barriers to accessing their hardship policies and programs, and as a result recommended that the Essential Services Commission amend its energy codes and water codes to remove those barriers. And so for the rest of the presentation today, I'll just take you through what those barriers were and then identify what we did to remove those barriers. So essentially, barrier one, and this was probably the most critical barrier, was that family violence wasn't recognised as a source of hardship in the energy regulatory framework that the Commission had helped create and implement, and in the hardship policies and programs that energy companies were rolling out. So what this meant is that energy companies had not designed systems and processes to identify and support customers experiencing family violence. So the practical, I suppose, application would have been customers calling up for assistance. Energy companies would have a list of questions they would ask to determine whether or not a customer was entitled to access assistance. Those questions would go along the lines of, have you lost your job? Are you entitled to a concession? Have you had an unexpected increase in energy consumption? None of these questions were prompting answers that would suggest the customer was potentially fleeing family violence and needed particular support in relation to that particular circumstance. The second barrier is, even when energy companies were open to considering family violence as a source of hardship, energy companies would then ask for evidence that the customer was indeed experiencing family violence. This evidence would include copies of intervention orders, copies of medical certificates. So we had essentially created a system which allowed energy companies to ask victims of family violence to demonstrate that they're most vulnerable, to require them to provide evidence of such a sensitive situation. Of course, this created barriers to accessing assistance, meaning many victim survivors simply walked away. Barrier 3, another outcome of not having hardship programs and policies designed to take account of family violence as a source of hardship is that account systems aren't designed to support customers experiencing family violence. This would mean account systems fundamentally were not secure and could be used by perpetrators to find out the location of a victim survivor who may have fled. So, for example, a perpetrator would call up an energy company and quote the date of birth or the maiden name of their victim survivor, and was able to access the information of the new location which they had fled. They would also do things such as, if it was a joint account, transfer the account into the victim survivor's name. So that victim survivor was then responsible for paying the debt of the perpetrator. Barrier 4, and I just touched on that before, the system that we had created often left victim survivors paying the bill. This, in addition to perpetrators going in to change the settings of the account, where the debt would simply be saddled with the victim survivor, often in joint account scenarios, when the perpetrator had fled and there's one person that's left remaining on the account, that customer would have to pay for the debt of the person who had simply fled, and would be subject to quite aggressive debt collection tactics. When victim survivors would call up their energy companies to seek assistance, to seek acknowledgement that it wasn't just them who had accumulated the debt. Unfortunately, in many cases, the response was, well, unfortunately, we can't find that person. You're the last person on the account that we can contact, and so we're going to go after you. And probably the other barrier is that energy staff simply did not know to help. Again, when your hardship policies and programs are not designed to support customers experiencing family violence, the training that underpins the implementations of these programs and policies doesn't help staff to demonstrate empathy in dealing with customers experiencing family violence. But it also meant that customers would often have to repeat their story to different staff within the energy business, because there was no training to support customers, to support staff, effectively recording the experiences of their customer who had experienced family violence. In 2018, we went about seeking to address these barriers. And we did this in a really unique way. We did this unlike any other energy regulatory process I had been involved in. What we did is we actually listened. We listened to the people, to the customers we were seeking to protect. And we didn't listen to them during one workshop, during one webinar. We listened to them for many months before we even considered developing a consultation paper, let alone writing the rules. And so essentially, going through that process, we probably implemented 5 key changes to address the barriers that had been created. The most fundamentally, we ensured that family violence was recognised as a cause of payment difficulty. We realised and recognised that if we were going to fundamentally change how energy companies engaged with their customers on this really important issue, that the central tenet of their hardship program, their payment difficulty program, need to acknowledge that family violence can cause significant hardship. Our framework also enables customers experiencing family violence to access support without providing evidence. When they call up their energy company and ask, for a payment plan, they ask to have their account secure because they are fleeing family violence. Energy companies need to take them at their word. There are some smaller scenarios where evidence may be required, but in large part for those key fundamental protections, customers experiencing family violence in Victoria can now access those entitlements without providing evidence.
Thanks, Sarah. I think we'll have to just wrap up for Q&A. I've just got my eye on the...
Oh, of course.
The
rest is self-explanatory there, that's right.
No, we've got some great questions actually that are going to allow us to pick some of that up. So I just want to make sure we've got them in. We've had a very active Slido discussion here, and so thank you both very much, and we've got plenty of questions. And I want to pick up with our most popular one, and perhaps I'll add a little bit to it because we've got a series of questions that relate, and I think these directly go to, Sarah, some of the points you were just making. So our top question is part of the problem that the people designing rules are by and large well educated and well remunerated, so they can't really understand the lives of recipients? And I think there's a couple of questions that also directly build on this. So one is really about the diversity or lack of diversity within government and how that feeds into administrative processes, and also sort of accessing and including in that the lived experience of people into our design processes. So Sarah, perhaps we'll start with you because you were sort of just on this point, and then we'll go to you, Don.
Absolutely, I think it's a fundamental issue of how these barriers are created. Is that I think in public service we're coming a long way in terms of the diversity of people who do regulate these industries, and so that's a good thing that we have a much more diverse workforce who are bringing diverse experiences, so who can ensure that the regulation we're implementing is relevant and is targeted. But I think it also goes to the way that you develop these regulations, and as I noted, the fundamental difference that I believe ensure that we could reduce these barriers is that we actually listened to the people we were actually trying to protect and support. And I think regulators need to do that much more often.
Thanks, Sarah. Don, what about you? You've been looking at these issues around the world. What is it about sort of the people who are designing the rules and perhaps their distance from the lived experience of what they might be developing those rules to apply to?
I think there's 3 possibilities. One is the one that Sarah just outlined, which is that you get something from learning about people's lived experience. So what Sarah articulated was a citizen-first approach to thinking about processes rather than an administrator-first approach. I think a second possibility is that you have more empathy if you've been in that situation. So I'm working on a study now where we looked at elected officials in Denmark and their tolerance for burdens And one thing we found was if they had been on welfare services themselves, they were much less tolerant of burdens on other welfare recipients. So it's something about being in their shoes. You have, I think, a little bit more empathy. And then there's a third possibility, which is sort of darker, which is that sometimes we design these burdens deliberately because we want to ration access to some sort of service. We have a limited budget, or we might have a bias against certain recipients of those services.
Yeah, thank you. I might pick up on an issue that's been a big one in sort of public administration practice and sort of the scholarship over many years, but is also becoming much more important at the moment, which is this issue of trust. And whether you think there's some sort of relationship between a decline in the trust in government and whether that affects the uptake of government programs, particularly among vulnerable populations. I mean, I've been really surprised, actually. I don't know how many of you follow the Elderman Barometer of Trust, but trust is back in government at the moment. And in fact, around the world, there's been the sort of aggregate level has been a double-digit sort of improvement in trust in government. How long that will hold is anybody's guess. I don't like to get into the prediction business, as I say, but at this sort of moment in time, trust in government is the highest it's ever been since that trust barometer has been developed. So how do you think this relationship between trust and how we think about government affects the uptake of programs? Don, perhaps you want to start with if you've got a sort of international perspective, and Sarah, you can chip in as well on sort of your experience.
Yeah, I think there's two things. In times of crisis, we want to trust government. So if you look after 9/11 in America, you have this long history of declining trust in government, a huge spike after 9/11 in the midst of this crisis, and then it declines again. So I don't know where we are at the moment, but when we're under incredible pressure, we are hoping that government will come through. But then I think there's the second issue is if you have an accumulation of negative experiences with government, and we're seeing this on the streets at the moment by protesters, by the Black Lives Matter movement, if your experience of government is consistently negative, it's hard to imagine it does anything other than erode trust in government and erode legitimacy upon which government needs to govern.
Yeah. Sarah, did you want to talk about this sort of relationship between trust? And I think particularly the example that you took us through where you had very complex sort of relationships and sort of the development of trust between those parties may have been a really important part of that.
Indeed, and I think it also, you create a framework where customers need, in order to get access to support in terms of paying, their energy bills, they're reliant on a private provider, and this private provider at the same time is actually increasing their prices without sufficient notification. And so these continued practices doesn't promote trust that this company is actually going to support me in my time of need. And so you're going to be less likely to actually go and speak to that company to ask them, for assistance in paying a bill, if at the same time they're increasing your prices every 2 weeks.
Yeah, there's a related question I might weave in here, Don, which is to you that you mentioned in part of the presentation that the use of third parties can increase inequality. And Sarah's example of that, of having sort of this intermediary party that could create sort of really conflict in that relationship and create really terrible sort of outcomes because they're pursuing perhaps different interests. You mentioned that in your talk. Could you give us a little bit more about that?
Yeah, we have some evidence from looking at studies of take-up of programs. If you have stronger social connections, or if you're more likely to be tied to, for example, unions, you're more likely to get access to unemployment benefits. And so if you can draw on help from those third parties, you tend to benefit from that. But if you're not part of those social connections or not part of those social networks, by definition, then you become excluded from those sources of help and find yourself really on your own dealing with this complicated administrative process.
I might ask a question now, which is about stigma, and both of you have talked about this in a different ways in your talks, and perhaps Sarah will start with you. The question was also to me, but I'll take the chair's responsibility of not answering any questions. I'm just asking the questions today. Do you have other examples of agencies which have deliberately gone about trying to reduce stigma of the engagement? Sarah, you gave us a really terrific example of how you've been involved in that, but have you seen other organisations doing that?
That's a good question, without notice.
You can handle, Don, if you like.
Don, you could take this first while I think about other agencies who've acted to reduce stigma. Yeah.
I mean, I can give you one example from the United States, which is we have what is colloquially known as food stamps, so income support. And the idea of food stamps, the name over time just acquired a stigma. It was associated with dependency, with welfare, with poverty, and people would have actual stamps, right? And one thing that happened is the government renamed the program to SNAP, which is an acronym, and then states also rebranded to something else. But also they gave people these electronic benefit transfer cards. So it works like a debit card, so you don't have stamps. And so the person behind you in line at the grocery store doesn't know that you're on welfare. So that's a really simple example where government took the time to think about, well, do we actually want people to not feel as much stigma if they take up these benefits? Yeah.
Sarah, I think time will relieve you of having to think of one. A very good, in Australia we'd say, a very good handball there to Don. We had such a terrific set of questions. I think many of which you touched on and which I'm sure we could speak about in another discussion, which is about, are we so terrified of people rorting systems that we rather see them go without than get anything? Which countries or agencies are leading in tackling bias in regulatory systems and looking at issues around implementation and the sets of skills that are also involved. So thank you very much to everyone for asking the question.